Hi there, my name's Stephanie Doody and I'm a healthcare science lead with NHS Forth Valley. I'm also the head of physiology with the Scottish Government. That sounds pretty complicated, but it's actually a really quite straightforward job. Healthcare science is an aspect of the NHS which is about diagnosis. So if you've ever been for a blood sample at your GP's, or you've ever had a hearing test, or had an ECG, or even used a bit of machinery that was in the hospital, well, all of that's been either tested by, looked after by, or you're actually seeing the healthcare scientists themselves. My actual role is an audiologist, so for the last 20 years I've been testing hearing and dealing with people who've got hearing problems. And it's probably one of the most interesting things of the job is dealing with the public. But now I'm actually working with the Scottish Government, and one of our main aims is to really raise awareness of science in the NHS and just science in general. I'm a STEM ambassador, which means that I spend a lot of time trying to encourage pupils at schools and even school children in primary schools to get more involved in science, particularly women, and this is why applying for this particular role was really appealing to me. I think we need to get out there the importance of science and just the enthusiasm for it. I've got some interesting stories. I think one of the times I went out to high school, I first of all asked the class, how many people in here want to do science? And they're all in a science class and not many of them really wanted to be there. And when I asked if any of them had plans to work for the NHS, none of them did. And when I asked them why, they couldn't really tell me. They thought the pay was bad, they thought it was a poor respected job, they didn't think the job would be of any interest, which I felt really sad about. The other thing as well, which I think just makes my whole my family science mad, is that when my son was asked at a holiday camp what he wanted to be when he grew up, he said a mad scientist, which I thought was wonderful, but I'm not sure how many degree courses out there do mad science and how good the pay is. So I think as far as being an expert goes, an expert with science with the Scottish Government, with 20 years experience in the NHS and with a real enthusiasm to try and get people interested in science. Thank you.